All right, in other news now, the antiretroviral drugs and other medical items that have been stuck at the port are now set to be released for distribution after the Ministry of Health secured approval and clearance for the same. This is according to the ministry, which has added that there are already drugs from other sources being supplied to avert a full-blown crisis. Mamo Ali reports that this would come as a relief to residents of Marsabit who had already been having a hard time accessing the ARV drugs even before the USAID Kenya government standoff.
The sting of the standoff at the port, where antiretroviral drugs have been held, has threatened to deal a huge blow to persons living with HIV and AIDS. In some counties, such as Marsabit, concerns continue to rise as the patients there say they have already been having a hard time accessing the drugs even before the standoff.
Kwetu kwanza ni mbali sana, ni pahali ambaye haijulikani kama tutaishi ama tutakwisha yote. Ikikosekana hata kwa mwezi moja, sisi tutakuwa tumekufa kwa sababu stigma yenyewe inatuua. Watu hapa wanatunyanyapa sana.
The news of the looming crisis left them in a state of concern and fear.
Tusipopata ARV, sisi waadhiri wa HIV tutanyanyapa, tutapoteza maisha yetu. Na tukipoteza maisha yetu, ni jukumu ya serikali kujua mwananchi yake anaishi wapi na atapata matibabu wapi.
The Council of Governors says it is working with the MOH to ensure communities are not affected by the ARV situation.
The antiretrovirals have to be availed to the people urgently, because currently there are counties with zero HIV commodities. This is very dangerous. This therefore means that the viral suppression of the people who are taking ARVs is compromised and increases their chances of dying due to HIV-related complications.
Wednesday afternoon, the Ministry of Health said it has sought approval and received clearance for the consignment stuck at the port of Mombasa to be released for distribution. USAID is now expected to hand over the drugs for distribution. MOH also says that it also received some drugs for other sources, and restocking of various health facilities around the country is ongoing. CS Mutahi Kagwe further adds that patients will receive enough drugs for short periods until normal supply resumes. The 1.1 billion shilling consignment has been lying at the port since January 18th after being slapped with a 90 million shillings tax bill. USAID had indicated that it wants to establish its own parallel drug distribution system in Kenya through Chemonix instead of using the Kenya Medical Supplies Authority, KEMSA. Some of the commodities that were being held include HIV testing, treatment and prevention commodities such as ARVs, as well as TB diagnosis and prevention medication. Mamo Ali, NTV.